The game of life is the game of boomerangs. Our thoughts, our words, our deeds all come back to us sooner or later. But all that we go through in this journey, our experiences, our gifts, and above all, wake up calls. Welcome, ladies and gentlemen, to Dr. Tapaswini's Corner. That's me, and I work as a head and neck oncosurgeon at Fortis Hospital, Delhi. To sail through the dark clouds of cancer, one needs to have a correct attitude, approach, and knowledge that makes a great difference when you're riding through the tough times. Many of us know about leukemia and lymphoma, but few know about multiple myeloma. To throw light on this disease, we have our expert today, Dr. Dinesh Bhurani. You are the director of the Department of Hemato-Oncology and Bone Marrow Transplant at the Rajiv Gandhi Cancer Institute and Research Center, Delhi. Having trained yourself from CMC Vellore and from Australia for bone marrow transplants, you are a leading hemato-oncologist of India with 20 plus years of experience and more than 1,000 transplants to your credit. Besides your pioneering work in this specialty, you are reckoned as the first doctor from North India to have performed a haplotransplant with success. Welcome, Dr. Bhurani, to the show, and it's indeed an honor and pleasure to have you today.
Thank you, Dr. Tapaswini, for inviting me. It's a really pleasure to be on your corner.
Thank you once again for being with us. You know, years ago, multiple myeloma was a hot topic of discussion in the media circle. And that's because we had our famous actress, Lisa Ray, who was diagnosed with the cancer and had a bone marrow transplant. So, Dr. Bhurani, tell us, what is multiple myeloma?
Before we go through, I'll just tell you, it's not only the Lisa Ray. Our two prime minister, Mr. Chandrasekhar and BP Singh, both had a multiple myeloma. They may not be highlighted
Right, correct.
in media, but they both also had a multiple myeloma, and they lived longer with the disease. When you say what is multiple myeloma, is one of the cancers, is a cancer of one of the white cells which are produced in the bone marrow. Is called a plasma cells. When the plasma cells are produced as a cancer in high numbers, they don't do a normal functions of protecting the body. They produce an abnormal protein which is harmful to the body.
Okay.
So that's a cancer of bone marrow, which is a plasma cell tumor, and that leads to the destruction of bones because it is multiplying in the bones. It leads to the renal failure in some patients, and it reduces the immunity of the body because the normal cells will be reduced because of the cancer.
Okay. So what a lay person would understand, because there's a lot of destruction happening in the bone, so there would be invariably some weakness which would be produced. So how common is this cancer in our country?
When the incidence of this cancer is not different in our country in comparison to the Western world. So it is usually a 1% of all the blood cancers. So of the blood cancer. So it is rare, but it's not very, very, very uncommon. So as the age grows, many of the older age group people can have a multiple myeloma.
So is there any particular age group that it commonly affects, or is there a particular age group which has a predilection for this cancer?
Usually, this is a cancer of old age. The more you grow older, the frequency of having a myeloma increases. In comparison to the Western world, the many of the younger patients also say the incidence is 1 decade earlier in our country. So probably we see many of young age myelomas too, but more you grow, the incidence of myeloma increases. Is not seen in children, so it's not a disease of children. Rarely in the young age group, more common in the elderly.
Right. So I think it will be very useful to know as to what are the various causative factors in this particular disease.
Usually there are no causative factors. you cannot contribute some lifestyle or some the personal habits to contribute to. It is related to the age factor. So normally the body produces the response as antibodies to the infection. So if you have a multiple infections or some chronic inflammatory reactions, that can lead to this tumor. But there is no direct factor. Usually there is no genetic factor to contribute to the myeloma. So in short, we don't know the cause. We cannot say preventing by personal habits or any environmental things which can prevent it.
So smoking and alcohol, which has been generally most of the time the causative factors for other cancers. So it doesn't play any role in this particular disease?
There's no direct relationship with the smoking alcohol. Like you have a lung cancer, esophageal cancer, which has a direct causative factor with the smoking and the lifestyle habits. There's no direct factor, but probably there may be some indirect relationship with this. There's no proven causative factor with the smoking and alcohol.
All right. But then how does one suspect this particular disease? In other words, what are the signs and symptoms of multiple myeloma?
Unfortunately, the symptoms are usually vague. So it affects the multiple parts of the body. You cannot say A symptom or B symptom, you have it and you have this myeloma. So as I said, it affects most commonly the bones. The bony pains are commonly the people have it. So you can have it with the vitamin D deficiency or with some muscular pains. You can have the pain. So there are more common causes of bone pains than the myeloma. And that's how it is ignored. Sometimes it affects the kidney. So there are multiple causes of having a kidney failures. The myeloma is one of the causes. So many times the diagnosis is delayed because there's no specific feature. I can tell you that this is a feature. Some people can have a low hemoglobin, and when you investigate them, and there are 1,000 causes of more common causes of low hemoglobin. So the myeloma is a rare cause of low hemoglobin. Myeloma probably is a rare cause of renal failure. Myeloma may be the few of the less common causes of bony pains. So these are the features which can be there. There are more common causes for these presentation, and it's not that everything will be present in everyone. So someone will have a presentation with the low hemoglobin, someone will have with the renal failure, someone will present with the bony pains. More commonly the people present with the bony pains, and then once you see the doctor's responsibility lies whether we are dealing with the less common causes of bony pains.
Can it be also asymptomatic and it's just picked up incidentally on investigations for some other disease? Does it happen that way?
Now, more commonly, the people are getting investigated. The routine investigations are done. Sometimes on the investigations, you can see a low hemoglobin and then they get investigated. Sometimes the calcium is high, then you can get investigated. Sometimes your protein levels, which are the abnormal proteins levels are high, and then you picked up. So you may not have a symptoms. And you can be picked up. One thing I should say, before the myeloma, you have a pre-myeloma syndromes. One is called MGUS. Another one is called a smoldering multiple myeloma. There you have abnormal proteins which is produced by these abnormal plasma cells. So these are pre-myeloma phases of cancer. Don't have any myeloma related symptoms. You can be labeled as a MGUS or MGUS or smoldering myeloma by the test, not by the symptoms.
So how do we investigate? What are the various investigations that we ask for? And tell us, what is that investigation which would clinch the diagnosis of multiple myeloma?
When to suspect it, when I said it can present as a low hemoglobin, it can present with the renal failure, it can present with the bony pains. So someone with being investigated for low hemoglobin can found to have some test done and found to have a low renal failure. You can find do a test and then you can suspect it. So suspicion will be with the hemoglobin, renal failure, and bony pain. Sometimes you can have X-ray which shows you the typical lesions, and then you investigate that and found to have the multiple myeloma. One of the tests is called to find out whether you are producing abnormal protein is called a serum protein electrophoresis, or more sensitive test is a serum immunofixation. So the protein is present in your blood, and you can find out. This is one of the blood tests. but is not routinely done. Whenever you suspect it and do this test, the majority of the myeloma produces this abnormal protein, and you can pick it up on these tests. Some of the myeloma do not produce this abnormal protein, and even if you do these tests, you may not find them. The most definitive test will be a bone marrow test, which is done later part of the test. So initially is a blood test, or you do X-rays and find out some abnormal these things are there, and then you do the further test. Among them, the bone marrow and PET scan are the most sensitive test, the more confirmatory test, which can confirm the diagnosis.
Right. So there's something called a gene expression profiling test that we do for this particular disease. Is this something which is routinely advocated, or it is done only in specific situations?
For diagnosis, we do not need a gene profiling. So once you do a diagnosis, is on the blood test, on the X-rays or PET scan, on bone marrow. So these are the tests we do it. Sometimes you do a urine test also. The abnormal protein goes into the urine, and you can pick it up on the urine test also. So for diagnosis, no gene profiling. For prognosis, how good or the bad is your myeloma, we do a certain test. Among them is most common is the FISH test, where you see a genetic abnormality. So certain myelomas are bad, which are considered as a high-risk myeloma. They have some genetic changes, which we pick it up on the FISH test. Is the common test is called a FISH test. Gene profiling is more sensitive test, but it's very cumbersome. It is available in a very high academic institutes. Even in India, not every institute has it. So you don't need them. So there are a more common tests which can tell you you have a good myeloma or bad myeloma. So actually, very rarely you do the gene profiling.
So this bad and the good variety, the risk stratification that we do, what is the main crux of this stratification? What all points do you put in to classify a patient to be in a good category and the one in the bad group?
One of the tests is called, one of the prognostic is called is the ISS, International Scoring System. And then they have revised it. It's called a revised ISS, it's International Scoring. So that determines your good or bad. Among them, as I said, the genetic changes plays an important role, which we pick it up by the FISH. So there are certain changes which you pick it up on the FISH. They are bad, certain are reasonably good. So the FISH test, then your albumin level, so the protein level, the normal protein levels, how significantly have gone down. And there is one of the tests is called LDH and beta-2 microgram. So there are certain blood tests and there are certain genetic tests which determines how good or the bad this myeloma is.
Great. So now let's talk something about the treatment. Do all patients of multiple myeloma warrant a treatment, or there's some category which may not be required, where you do not require?
I think this is a very good question. Not when we label it as myeloma, then you need a treatment. As I said, there are pre-myeloma stages. One is called MGUS. Another one is called a smoldering myeloma, where you do not need a treatment. So you have a precondition. Many patients may be asymptomatic, remaining stable for many years, and do not require a treatment. So you may panic, you have this, but treating early or treating when you change to myeloma, when you progress, does not make a big difference. So sometimes you have this abnormal protein, sometimes you can have a certain plasma cells in the bone marrow. So certain changes you can see on the investigations, and you're not labeled as a myeloma, you are still labeled as the different categories. You are diagnosed, but you don't need a treatment. But once you are labeled as a multiple myeloma, that implies that your body is getting destroyed by this cancer, or you're likely to be destroyed in 1 or 2 years. That's a time when you need to be treated. So myeloma needs to be treated, but the preconditions do not need to be treated.